Hi, my name is Julie Van Schalkwyk, and I'm an obstetrician gynecologist. I've been working for about 12 years, and I did some extra training after my original residency because I have an extra interest in infections as they relate to pregnancy. So, depending on the virus or bacteria you're speaking about, the rate of infection of pregnant women and the transmission risk is highly variable. So it really depends on the organism itself. For example, the number of women infected with HIV who are also pregnant in the province of BC is very low. However, we see about 30 to 40 cases per year. The risk of transmission is very high if you're not treated in the pregnancy. Another type of virus that affects many pregnant women is genital herpes. So about 30% of women are affected by genital herpes, and about 30% of pregnant women are affected by genital herpes. As long as it's managed appropriately and the history known, the likelihood of transmission to baby is very small. So hepatitis B is another virus that affects about 1 in 100 women within the province of British Columbia. The likelihood of transmitting the virus to baby, if appropriate testing is done in pregnancy and appropriate treatment is offered after pregnancy, is quite low, thought to be 1 to 2%. There are some women, however, who have a very high level of virus in their bloodstream in pregnancy, and their risk of transmission can be quite a bit higher, about 30%. We are working on ways to offer these women medications in their pregnancy to reduce that risk to less than 1%. With any infection, be it sexually transmitted or not sexually transmitted, and as I mentioned before, there's well over a dozen that we consider. The important thing is to get tested before you conceive. So seeing a care provider and talking about what health issues there are related to a future pregnancy and having some screening done can allow you to potentially prevent a number of infections that you either may acquire or may currently have, and in effect reduce the risk to baby. There are some vaccines you can receive before pregnancy that can reduce your risk, and there are some medications that you can take before pregnancy that will also reduce risk to baby. Considering all infections that can have an impact on pregnancy, greater than 30% of all women are at risk of some kind of infection. So having a good health review before considering pregnancy, or at the very least being seen very early on in pregnancy and having all of the appropriate screening blood work done, is a really good way to start. And the reason being is for all of the infections that we typically do screen for in pregnancy, we do so because we have ways of helping prevent the infection being transmitted to baby. And the sooner we know about it in a pregnancy, the better. There have been enormous improvements made in treatment of a number of infections that can affect pregnancy. For example, HIV. Transmission rates typically in the absence of any treatment is about 50%. We now know that with good control in pregnancy, that obviously requires knowing your status, and then very close follow-up of baby afterwards and avoiding breastfeeding, we can reduce the risk of transmission to less than 1%. Similar things are happening with other infections, for example, hepatitis B. We know there are new medications on the horizon and some being used now that can dramatically reduce the risk of vertical transmission.